Welcome back. June is National Men's Health Month, a time to remind men of the health issues they face and what they can do to take charge of their health. Joining us is Dr. Jorge Rodriguez, who is board certified in internal medicine. He's here to talk about men's health today. Okay, screenings, absolutely crucial, but some men avoid it.
Oh, for sure. Well, first of all, thank you for having me here.
Of course.
You know, I think the first thing we need to do is have men get over their own machismo. You know, because we're supposed to, right, the resistance to go. And by the time you go, it may be a little bit too late to do anything preventative.
Right.
So my magic number is 35. I think if a man has not gone to see a doctor for a full physical by 35, he needs to get on it. For the simple reason that, for example, at 40, you should be checked, for example, cholesterol, for diabetes, and at 45, you need colonoscopies. And the main things that kill men, heart disease. So you need to know your blood pressure. You need to know your cholesterol, and you need to know who your people are. By that I mean you need to know your family history. There's something run in the family so that you can then bring that to the doctor and we can create a plan. So the biggest killers, heart disease. Secondly, cancer. If you're a smoker, you need to have a CAT scan of the lungs done at the age of 50. Even if you stop smoking, if you haven't stopped smoking for 15 years, you still need yearly CAT scan checkups. The next one is
so important.
It is very important. You know, we just take it for granted.
Right.
And then the big taboo with a lot of men, colonoscopies. Okay,
right.
all right, self-explanatory.
It's scary to some people.
Of course,
so,
it's scary to almost everybody. But we have moved the age at which you should do colonoscopies down to 45 because we're seeing so much colon cancer. So you know what the main symptom of colon cancer is? No symptom.
Oh.
Right?
Yeah.
By the time you have bleeding or you have constipation, something is blocking it and it's already too far gone. All right, so lung cancer, colon cancer, diabetes, high blood pressure, those are the main things that men need to be checked on. So
it's always so much better, to be preventative than reactive because, like you said, it might be too late at times.
Yeah, but the toughest thing that I find is that since we don't have any symptoms with diabetes or blood pressure, most people do not get checked. By the time you have symptoms, it's too late. For example, take sprinklers. Right? They work until the day they don't.
Yep.
But all that time they've been clogging up, just like arteries.
Right. Your body is your most important possession. You have to treat it well. And
Absolutely.
Some people just, they don't check up on it.
Absolutely. You know, until it's too late. We treat our cars better than we do our bodies.
Yeah.
It's true.
What are some other common things you see with your patients?
Well, the most common thing I see nowadays is that a lot of people Dr. Google. Not a bad problem. Knowledge is good. But you know what? I can read a recipe 1,000 times. Doesn't mean I know how to make a cake. Which means that you can read an article, you still should listen to the experience of your physician. A lot of people now are more afraid of medications than they are of the actual diseases. Well, I think that just ties into the fact that a lot of people don't want to admit, A, that they have something wrong, and B, every time you take a pill, it reminds you that you either have high blood pressure or high cholesterol. So what do we need to do? Be open to the possibilities and take care of yourself early. Okay, all very good to know. So you heard Dr. Rodriguez, get screened, take preventative action. It's better than what could happen down the line. Absolutely, thank you.
Thank you so much for being here and reminding everyone, men's health, get it done.